Opioid overdoses continue to affect the community. And now, as ABC7's Bobeth Yates tells us, the health department, local nonprofits, and hospitals are all teaming up in hopes of tackling the epidemic once and for all. Bobeth.
Well, officials say they've implemented rehab programs and they've even gotten law enforcement on board. But now they're turning to physicians to stop the substance abuse problem.
When the prescription drug epidemic hit, when we all worked together initially, we saw a decrease in the number of overdoses in our community. With the advent of heroin, we've seen a bit of a spike heading in that direction, and we recognize we need to re-up our efforts again and really go back after it.
PJ Brooks is with First Step, a nonprofit that focuses on substance abuse treatment. He says the rise in heroin is being linked to opioid prescription drug abuse and the crackdown on those prescriptions.
Individuals who have maybe become addicted initially to prescription drugs, they may now have limited access to it and are turning to the streets to heroin to get their opiate high.
The issue has prompted new state legislation, and now the CDC is also stepping in, implementing new regulations.
The CDC guidelines that have been recently issued, have said that in many respects that we have been overprescribing for pain. We've prescribed opiates for too long and in too large a dosages.
The new guidelines are encouraging physicians to prescribe non-opioid drugs from the beginning, which could help eliminate the initial addiction. But Brooks says many doctors aren't even aware, a problem that has prompted several organizations to come together to launch a new campaign.
Attacking a public health issue requires a community approach across the entire system. So it takes law enforcement with their role. It takes treatment centers providing treatment alternatives. It takes our providers having awareness about the dangers of opioid prescriptions and how to prescribe safely and what the alternatives are.
Chuck Henry is with the Florida Department of Health in Sarasota, and he says if they're unable to get physicians on board with the new guidelines, solving the opioid epidemic could be next to impossible.
It continues to be a problem in our community as we get our arms around one piece, those with addictions shift to another, and really what we're interested in doing is trying to help individuals cure their addictions and regain a full and vibrant, healthy lifestyle.
Now, in the coming weeks, the health department, local hospitals, law enforcement, and First Step will host several information sessions for physicians, and they're encouraging doctors to sign up. Now, for more information on that, you can go to our story at our website, mysuncoast.com, and get a link.